Imagine this. You're sitting across from someone at lunch, maybe your spouse, a parent, or a close friend. Suddenly, they clutch their chest. You freeze. Is it a heart attack? Or is it something worse, like cardiac arrest? Do you know the difference? Would you know what to do? The terms heart attack and cardiac arrest often get used interchangeably, especially in everyday conversations. They both involve the heart. They both sound terrifying, and both can be life-threatening. But in truth, these are two entirely different medical emergencies, and knowing the difference isn't just important, it can literally mean the difference between life and death. In this video, we're going to unpack both of these conditions. What exactly happens inside the body during a heart attack and a cardiac arrest? How to spot the signs, what causes each one, and most importantly, what you need to do if either happens to you or someone nearby. This is not just information, it's life-saving knowledge. And whether you're in your 40s, 60s, or beyond, this is something everyone should understand. Part 1. What is a heart attack? Let's start with the one most people have heard of, the heart attack, also known medically as a myocardial infarction. What happens during a heart attack? At its core, a heart attack occurs when blood flow to a part of the heart is blocked. Your heart, like every other organ, needs a constant supply of oxygen-rich blood to function. This blood is delivered through the coronary arteries. When one of these arteries becomes partially or completely blocked, often by a buildup of plaque, which is made of fat, cholesterol, and other substances, a section of the heart muscle becomes starved of oxygen. If that blockage isn't removed quickly, the tissue begins to die. Think of it like pinching a garden hose. The water can't get through. If that hose were feeding a plant, the plant would begin to wither. That's exactly what's happening in your heart. The longer the blockage lasts, the more heart tissue is damaged, which can lead to long-term complications or even death. Symptoms of a heart attack. Now, you may be picturing someone gasping and grabbing their chest. And yes, that can happen. But the signs of a heart attack can vary widely and are often more subtle than you'd expect. Here are some classic and not-so-classic symptoms. Chest discomfort or pain. This might feel like pressure, squeezing, fullness, or pain. It can last for minutes or go away and return. Pain in other parts of the body, especially in the arms, usually the left, neck, jaw, back, or stomach. Shortness of breath, with or without chest discomfort. Cold sweat, nausea or lightheadedness. Fatigue, particularly in women. Fatigue can be an early and persistent symptom. It's also worth noting that not all heart attacks come with intense, obvious symptoms. Some people, especially women, older adults, and those with diabetes, may experience what's called a silent heart attack. That means little to no pain and symptoms that mimic indigestion, anxiety, or the flu. And here's something surprising. During a heart attack, the heart usually does not stop beating. It's still pumping, just struggling. Part 2. What is cardiac arrest? Now, let's shift to a far more sudden and dramatic event. Cardiac arrest. What happens during cardiac arrest? Whereas a heart attack is a plumbing problem, a blocked artery, cardiac arrest is an electrical problem. Your heart beats thanks to a sophisticated internal electrical system that keeps it pumping in a coordinated rhythm. But sometimes that system malfunctions. The heart begins to beat irregularly or even stops altogether. This is known as an arrhythmia, and the most serious kind is called ventricular fibrillation. When this happens, the heart can no longer pump blood to the brain, lungs, or any other part of the body. Within seconds, the person loses consciousness and stops breathing. Without immediate intervention, such as CPR or defibrillation, death can occur within minutes. Symptoms of cardiac arrest. Cardiac arrest is immediate and unmistakable. Sudden collapse, no pulse, no breathing, loss of consciousness. Before cardiac arrest, some people may experience warning signs such as chest discomfort, shortness of breath, or palpitations, but often it strikes without any warning at all. Unlike a heart attack in cardiac arrest, the heart has actually stopped or is quivering uselessly. Part 3. How are they different? Let's break this down side by side to make it crystal clear. Heart attack, cardiac arrest, caused by a blocked artery, caused by electrical failure. Blood flow to the heart is cut off. Heart stops beating effectively. Person is usually conscious, person is unconscious. Symptoms may be mild or severe. Collapse happens instantly. Heart keeps beating. Heart stops or quivers. Can lead to cardiac arrest if untreated. Requires immediate CPR and defibrillation. And here's the kicker. A heart attack can lead to cardiac arrest. In fact, many cases of cardiac arrest are triggered by a heart attack that disrupts the heart's rhythm. Part 4. Who is at risk? Both conditions become more common with age, especially after 40, and particularly after 65. Risk factors for heart attack: high blood pressure, high cholesterol, smoking, diabetes, obesity, sedentary lifestyle, family history, stress, poor diet. Risk factors for cardiac arrest: previous heart attack, heart failure, cardiomyopathy, genetic conditions like long QT syndrome, drug misuse, severe electrolyte imbalances. While heart attacks are more likely to be caused by lifestyle over time, cardiac arrest is more often linked to pre-existing heart conditions or a sudden trigger. Part 5. What to do in an emergency. Knowing what to do can save a life, and you don't have to be a doctor to make a difference. If you suspect a heart attack, 1. Call emergency services immediately, 911 in the U.S. 2. Keep the person calm and seated. 3. If the person is not allergic and has it available, have them chew aspirin, 160 to 325 milligrams. 4th, monitor their breathing and pulse. 5. Don't delay, every minute counts. If you see someone collapse, cardiac arrest, 1. Call emergency services immediately. 2. Check for breathing and pulse. 3. If no pulse or not breathing, start CPR immediately. Use an AED, automated external defibrillator, if available. 4. Continue CPR until help arrives. Every minute that passes without CPR and defibrillation reduces the chance of survival by about 10%. Part 6. Final thoughts and prevention. Knowing the difference between a heart attack and cardiac arrest is not just academic. It's practical, potentially life-saving knowledge that could help you, a friend, a family member, or even a stranger one day. How to lower your risk. Stay active. Even walking helps. Eat heart-healthy foods, vegetables, lean proteins, whole grains. Avoid smoking and limit alcohol. Keep your blood pressure and cholesterol in check. Manage stress through meditation, prayer, nature, or hobbies. Get regular checkups, especially after age 40. Know your family history. Heart disease doesn't care about your schedule, your job, or your plans. But the good news is, you have more control than you think. By understanding your heart, treating it with care, and learning how to respond in emergencies, you're already miles ahead. So next time you hear about someone having a heart issue, you'll know to ask, was it a heart attack or cardiac arrest? You'll know what each means, how they're different, and why it matters. And more importantly, you'll know what to do if it ever happens to someone near you. If this video spoke to you in any way, let me know by typing 1 in the comments. If it didn't quite land, type 0. Your feedback helps me improve and serve you better. At Life After 40, we believe knowledge is power, especially when it comes to your health. If this video helped you better understand the difference, please give it a like, subscribe for more helpful health content, and share it with someone you care about. Until next time, take care of your heart. It's the engine that powers your beautiful life after 40.